health insurance companies know this. They're not dummies. Um, Only 4% of plan participants can actually define the four basic terms of insurance, of deductible, coinsurance, copay, and out-of-pocket max. Only 4% of people can actually accurately define them. So what they've done historically is they've tried to use financial incentives to steer people. And if you don't understand the financial incentive, then it can't work. The financial incentive has to be understandable in order for it to be impactful. And so these alternative health plans are like, well, screw it. We're throwing out the entire idea of deductible coinsurance and out-of-pocket max, and we're just going to copays. Because of all of these, the copay is like, well, just tell me the price. Well, the copay is the price in terms of the out-of-pocket price for the member. So a lot of these alternative health plans move to a copay-only model so that you no longer have a deductible or coinsurance. And then they use those copays in a tiered fashion to steer people away from knuckleheads and extortionists. And they essentially what they'll do is they'll have sort of different. I think Surest has two tiers, and at Simple Pay and Coop they had three tiers where it's like a stoplight. Green was the lowest copays, yellow was the middle, red was the highest. And red was essentially the knuckleheads and the extortionists. And they said, okay, look, they're still a network. We're not going to say that they're not a network. But if you want to go to a knucklehead or an extortionist for an inpatient hospital stay, it's going to cost you $3,500. Whereas if you go to somebody at the other end, it's going to be $1,800. And if you're going to have outpatient surgery, it's going to be $2,000. But if you go to one at the other end, it's going to be $750. Right. So they're using tiered copays. And when you use a tiered copay, then you can, and this is for the bundled service. So everything between the day of admission and the day of discharge, or everything on the data service. So you go in, if you have lab and blah, 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 like you're not getting separate copays. It's not like a $750 copay for the surgeon, a $750 copay for the anesthesiologist, a $750 copay for the facility. No, it's not three copays. It's one $750 copay for the consumer. And then the adjudication on the back end for payment goes out to the surgeon and the anesthesiologist and the facility. I mean, that or pathology, they take a biopsy, et cetera, et cetera. Like that absolutely still happens. But the patient is taken out of that. That sort of divvying out and parsing out of the payments to the different providers, the patient is completely taken out of that.